Dr. Jim.
Thank you very much. Those were kind words. I tell you, this is an awful hard act to follow the general. But I tell you, for one, I'm getting off my duff and I'm going to start doing some stuff. So Dee kind of gave me a half hour to work, and what we're going to do is we're going to have Linda Jarrett speak for a little bit, then I'll speak for a short time, and anybody who is interested in getting up, and if you've got a complaint, if you've got a question, if you just have an opinion, please come up, get in a chair, and then we'll use the remainder of our time to deal with that. And we've got a half hour, and by golly, I'm going to make this end in a half hour, I promise. So, Linda Jarrett, I had the pleasure and privilege to speak with her yesterday for a considerable amount of time, and she went over a lot of the history of medicine as she saw it, as she came through nursing and moved into nursing administration. She has a lot of wonderful insights into the history of medicine. And America has the best health care in the world. Most every great discovery and innovation has come from here. We have the best doctors, we have the best and most advanced diagnostic equipment, and we have the best hospitals. Now let's not blow it. We, as physicians, have known for a long time that there is a problem within the practice of medicine, and that problem is the federal government. The federal government has used Medicare and Medicaid to weasel its way in and to manipulate the practice of medicine. We do not have free market forces at work in healthcare. If we did, costs would be lower and quality would be higher. What we have in medicine is too much regulation, too much bureaucracy, inefficiency, and increasing costs. And why do you think that is? Because that is what you get anytime you let the government get involved and take over an industry. In some industries, we can accept this, but not in healthcare. There are too many lives that are on the line. What they have done is to create this crisis, and we know that they will never let a good crisis go to waste. But we must stop them from this hostile takeover. It is not too late to reclaim the healthcare system from those who seek to change it forever. The people have spoken in Massachusetts with Scott Brown, and we will continue to speak until we get this thing right. There is a reason that the practice of medicine is called the art of medicine. And this art is the mixing and balancing of science with the personal relationships. Each patient I encounter is complex and unique. Socialized medicine and cookie-cutter mandates do not allow us as physicians to practice medicine as a science and an art. The patient-physician relationship is a sacred relationship, and we must start with this relationship in order to get us back where we need to be. The conversation must start with us, and then move out to include our community hospitals. And after that, we then move out to include our states to make sure that all the communities are taken care of. It is only after we've gone through that process do we ever turn to a federal government and to ask them to be involved. And when we turn to them and ask them to be part of the conversation, we really only want to ask them what they can do to take away the barriers, to decrease regulations so that we can run more efficiently. There are some easy solutions to our financial crisis in medicine that we can implement without disrupting the foundation that served 90% of Americans well. Linda mentioned a few. I think some of you probably know these, but that is to allow all medical expenses to be tax deductible, allowing insurance companies to sell products across state lines, allow doctors to deduct the cost of their care they give to the uninsured. We should also allow individuals to have the same right to purchase health care policies with pre-tax dollars that businesses enjoy. Everyone should be able to have a health savings account, no matter what type of insurance plan you have. So what do we do about this? I know a lot of you are involved with calling, faxing, writing your representatives. You've got to continue to do that. But what can we do as individuals? I think we also need to work on electing officials that will address these problems and not just talk about them. We need to quit sending lawyers to Washington that become career politicians. All these lawyers know how to do is make laws, regulations, and create bureaucracies. We need to find candidates that are doctors, teachers, small business owners, and then and only then will we the people have a voice in this country's future.